Hi everyone, and welcome back to Dental Fulcrum. This is video number 2 in a series of videos in identifying teeth numbers and letters according to the universal number system. Let's begin. If you are interested in becoming more familiar with dentistry and enjoy learning new and valuable skills as a dental professional, then subscribe to Dental Fulcrum on YouTube, where you will find more content videos that will enhance your knowledge and skill set. In this video, we will learn a few new dental terms that are widely used in dentistry. We will also learn how to identify the differences of dental arches, and lastly, we will learn about dental quadrants. We will also take a short quiz at the end of this video to see how much we have learned before progressing to the next video. Make sure you have your notes available. Let's begin. Here are some dental terms that you will learn as we progress through the video. You will hear me use these terms periodically, so I suggest you pause the video now, write down these dental terms and definitions. It'll also be helpful if you use these dental terms in your communication moving forward. In this slide, we're going to look at dental arches. The oral cavity has 2 arches. The top arch is known as the maxillary, and the bottom arch is known as the mandibular arch. These arches are individuals separated by an imaginary axial line. The maxillary arch is typically illustrated using an upside-down U shape. The maxillary arch is located on the maxilla, and the mandibular arch is located on the mandible. The mandibular arch is typically illustrated as a traditional U shape in a diagram. The maxillary arch is commonly referred to as the top arch, the upper arch, or the maxillary, whereas the mandibular arch is typically referred to as the bottom arch, the lower arch, or the mandibular. Here we see a more anatomical illustration of what the maxillary and mandibular arches would look like with teeth. Notice the axial line still exists, showing the division between the top arch and the bottom arch. It's important to notice the arrows and the directions that the arrows are rotating. Notice the top arrow begins on the patient's right side and rotates to the patient's top left side, continues down to the patient's lower left side, and then continues over to the patient's lower right side. This is important to identify because we are going to begin learning about quadrants and the order of the quadrant flow. Before we discuss quadrants, I want us to identify one last thing: the midline. We identified the axial line, which is imaginary. The axial line divides the maxillary and the mandibular arch. The midline is also an imaginary line, and it divides the left and right sides of both arches into equal halves. Notice in this illustration, there is an imaginary or illustration of an imaginary line that would exist if we were to draw it directly down the middle of both arches. This is known as the midline. So now that we've identified the axial line and midline, and know that both of these lines are imaginary, we can see how these lines will divide the arches into quadrants. This is an illustration of a face divided into quadrants. The diagram is illustrated according to the viewer's perspective. So if you're facing the patient anteriorly, which means from the front, face to face, this is what that illustration would look like. And finally, we see the quadrant formation. When each arch is divided by the imaginary axial line and midline, we identify 4 quadrants. Each arch half is a quadrant. These quadrants are numbered in chronological order and progress in a clockwise direction. The quadrants are numbered 1, 2, 3, and 4. Notice, Quadrant number 1 exists on the maxillary right side or the upper right side. Quadrant 2 exists on the upper left side or maxillary left side. Quadrant 3 exists on the lower left side or lower mandibular left side. Quadrant 4 exists on the mandibular right side or the lower right side. Congratulations, you made it through this video, and hopefully you learned a little bit about quadrants, about arches, and about midlines. Now let's test your knowledge. Locate quadrant 3 on this illustration. If you said quadrant 3 is located on the mandibular left side or the lower left side, then you're correct. So far, so good? Now tell me, where can we locate quadrant 2 on this illustration? If you said quadrant 2 exists on the maxillary left side or the upper left side, then you got it. Good job. Can you tell me where we can find quadrant 4 on this illustration? If you guessed the mandibular right side or lower right side, then you are correct. Great job. What about quadrant 1? Where is that located? If you said the patient's maxillary right side or the upper right side, then you're correct. Congratulations, we just completed identifying all 4 quadrants. Continue to practice this at home or in your classroom. Identifying quadrants is very important as we continue to learn how to identify teeth numbers and letters according to the universal number system. Great job! We just completed video number 2. In this video, we identified the maxillary and mandibular arches. We also understand a little bit more about the midline and how it divides both arches. We finally were able to identify quadrants and understand a few dental terms on the way. Thanks for joining us. Continue on to the next video to learn more about the universal number system and how to identify teeth numbers and letters.